Yeah, so I'm in the medication room. So first I will open up the MAR to check the medication due right now for my patient. There are three. So one is Zofran, 4 microgram is the right patient, right medication, right route, right dose. Check the expiration date of this medication, looks good. And the other one is the sodium chloride. Check the color and clarity. Expiration date looks good, and it's a due time for my patient. And the third one is the ciprofloxacin. It's antibiotics ordered for my patients. Check for the clarity, color, expiration date, looks good. Then I pre-made the medication label and put onto these medications and grab all the supply will be needed and then approach to the patient. So, hi Mrs. Wood. I'm Hui Yuan, I'm your nurse today. First, let me provide some privacy here. I know you have some symptoms of nausea and you got the UTI, right? So your provider ordered some medication to help you feel a little bit better. Let me clean my hands first. And at the same time, can you verify your name and date of birth? Okay. Also, I want to know if you have any allergy with the free or ciprofloxacin?
No, I don't.
No. Okay, thank you so much. Let me open the Epic here to check the mark. Okay. So first, I'll give you the IV push of Zofran, 4 microgram to you. So it will be 2 milliliter, and it will treat your nausea and vomiting. At the same time, it may have side effects as headache, dizziness, and constipation. If anything like that happens, let me know, okay? And the contradiction for this medication will be allergy to this medication and severe liver diseases, which I don't think you have those issues. And the safety dose of this medication will be 4 microgram per 12 hours. Okay, let me scan your wristband quickly. And this medication, so it's the right medication, right patient, right time, right dose. Okay, I will draw the medication from here. I access the IV side. It looks no red, no swelling, no inflammation, no infiltration. Looks good. Okay, let me draw this 2 ml. 2 ml of the air first, and then insert into this medication. Then go to 2.
Dizziness, and nausea.
Okay, then get rid of the bubble, air bubble. Okay, then put it back. Also, I want to check the patency of your IV tubing. First, let me clean this portal. And use alcohol pad to clean for 15 seconds and let it dry for 5 seconds. And this is a new zero saline. I will push 5 ml first.
Considerations are
can you feel any pain? No? Okay. No resistance. So it's clear. Okay. At the same time, let me grab the medication. This medication will be administered slowly, 2 ml in 2 minutes. Okay. Feeling good? Okay, 2 minutes passed. Medication has been done. And then I use the saline to flush the rest of the medication in the tubing to the patient. Add in 1 minute for the first meal. Then I can push the rest into the patient, and then use a new
And go.
sterilized cap to keep the bottle sterilized. Okay. Next, I will set up the IV medication for you. First is the sodium chloride. It's a normal saline, also called normal saline, and it will help you to keep hydration and keep your electrolytes balance. At the same time, it may have some side effects like fluid overload or electrolytes imbalance. And the rate is like 7 drops per 20 seconds, and the safety dose will be 75 to 125 milliliter per hour. So I'm reusing the supply, so I will set up here. Pretend this is a new primer tubing. Okay, I open the tubing and detangle it. I make sure to lock the tube here and make here every step is sterilized. Okay. I open the MUR to check this is the right medication, it's the right time, right dose, right route, right patient. I scan your wristband, I scan the medication, then I can set this up and start to prime the tubing. Okay, I open the lock slowly. So I squeeze this tube to make sure it's like half or 1/3 filled in here, and then open the lock slowly to prime the tubing. Make sure there's no bubble.
Hi, my name's Ty. I'm your nurse today.
Okay. And double check in the MUR, so the rate will be 7 drops per 20 seconds. Okay, so I have checked the patency of the IV tubing here just now. But I will just in case open and clean with alcohol pads for 15 seconds and let it dry for 5 seconds, and the connection to the IV fluid. Okay. Then I will slow titrate at 7 drops per 20 seconds. I'm looking at my watch and counting the drop. So it looks good. Okay. And then I will initiate the antibiotics. So it calls ciprofloxacin, and the dose will be 200 microliter per 15 minutes. And the drip rate will be 10 drops per ml. So I pre-calculation, so it's about 44 drips per 20 seconds. Okay, since I have checked with you, you have no allergy to this medication. But yeah, I do want to know there are some side effects of this antibiotics. It may also cause headaches, dizziness, or photo sensitivity. And contradiction will be allergy, so you have no allergy. And also pregnancy and breastfeeding will be the contradiction to this medication, which I don't think is applied to you. Then I will do the prime tubing here. This is the second tubing. Suppose it's a new one and sterilized. Okay. In the MUR, after I check in the MUR, it's a right medication, right patient, right route, right dose, And then let's scan your wristband one more time
is,
and
drop
scan
weight is
this
10 drops per
medication.
milliliter, which works out to
Okay.
be
Then I start to
40
priming the
drops
tube.
per 20 seconds. So, we're going to
Keep every step
withdraw
sterilized.
our first medication,
Okay,
and,
then hang this up.
alright,
Then, yeah, the tubing is locked. Make sure it's locked initially, and then squeeze to make it half full, half filled in this tubing here, and then open slowly to priming the
so if
tube.
we
Make
had
sure
one
there's no
that
air
was
bubbles.
working, or if we let's
Okay.
just grab another one.
Then I try to connect this second tubing into the T-tube system.
Okay, great.
Use alcohol pie to clean for 15 seconds and dry for 5 seconds,
Alright,
and
so
then connect
we
the
are
second
going to
tubing into the T-tubing system,
withdraw over 2
and then
milliliters.
lower the primary
Okay,
bag.
so we can, the reason we
Okay.
withdraw more than that is then we'll want to shake that air bubbles
Then
out.
as I
And then we're gonna inject air
calculated,
into
so
air.
this rate will be 44 drops
Invert it,
per 20
And we are
seconds.
going to withdraw
So I look up my watch
over a little bit over 2 milliliters.
to
Okay.
titrate.
The reason why is that we want to, over the crash, we're gonna
A little
inject
bit.
down a little bit on the air bubbles and no air bubbles. Okay.
Okay, then I count for
You're going
20
to-
seconds.
You have the
It
needle.
looks good to me.
Okay. And we'll leave it
Okay.
there.
Then I access the IV side for one more time. Make sure there's no inflammation, no redness,
Sterilize.
no infiltration. Do you feel any pain? No?
15
Okay, good.
seconds. Rubbing and protection.
Let me know if you have any headache or dizziness, okay? I will make sure your leg, your body is low and locked. Call light is here. Make sure if you feel anything, just to call me.
Alright.
Um,
No air bubbles.
And
Okay.
I
Absolutely no air bubbles.
I just pretend I use
Slowly.
the label
About 3 milliliters.
to write my initial and date
And before
for
we-
the
we do
tubing
that, we check
for the
the
other
site for
nurse to
pruritus,
know
which is
when I
redness,
initiate this
inflammation in the
tubing.
vein,
And then
or,
within that, I clean my
infiltration,
hand
which is leakage and
and
coolness
document all medication in the MAR,
There's none of that, so we're going
and
to
also document the IV medication under the input and output section.
and so now
um,
we're going to
Yeah. With
administer
that,
the
I
ondansetron.
think the IV medication skill like completed.